There is so much more to a pelvic floor muscle assessment than just if you can perform a squeeze. When you think about it, our pelvic floor has to support us all day. And there are muscles that travel from our back, across the pelvis and onto our hip bones. There is a pelvic floor within the pelvic cavity here. The pelvic diaphragm is made up of those pelvic floor muscles. There are muscles from our hamstrings that attach to our pelvis and from our adductor muscles. So the pelvic floor is a little bit more than can we perform a squeeze. It's so important for support. It is the lowest part of our core. And when we think of core, we think of abdominal muscles. But here I think is far more important, and it's just somewhere that we do need to pay more attention to. A women's health physiotherapist like myself will test your pelvic floor for so much more than if you can just perform a pelvic floor squeeze. We look at the performance of that contraction. We look at how long you can hold that contraction. How many times can you repeat a quality contraction? We look to see if not only can you hold that contraction, we look at the fast twitch. How many quick contractions can you perform? We look at your ability to elevate the whole of your pelvic floor. We check that no other muscle activity that's unnecessary is going on, that you're using different muscles. You need to be able to separate your stomach muscles from your pelvic floor. But we also need to see if you've got that timing. So can you squeeze and cough at the same time? So, your pelvic floor is so much more than I can squeeze. And if one part of that isn't performing to its optimum, this is where you can increase your symptoms of maybe a prolapse or your incontinence. And it's all about having that perfect score. So a pelvic floor muscle assessment is a perfect score. Do you know yours? Now, Janet here has very kindly offered to be a model for me. So once we've made her comfortable and very relaxed, because obviously this is a very personal experience, but basically it's very important to have a true pelvic floor assessment so we can personalize the rehabilitation of the pelvic floor for that person. So first of all, we use some lubrication, and the first thing we're looking for is we're moving into the vagina and we're just pressing on one side to the other to see if there's any differences, if one side's tighter than the other. And then we just do a nice sweeping movement all the way around the pelvic floor. So it's a sweeping movement one way and then all the way around the other to see if we can feel any tightness, any abnormalities, and just get a general idea of the pelvic floor. So then we're going to ask Janet here to squeeze, and we're going to feel the performance of that. My fingers now become the biofeedback. So basically she's going to squeeze against my digit, and it's like, come on Janet, squeeze as hard as you can and relax. So we look at the quality of the pelvic floor contraction, and then as part of the pelvic score we're then going to see her endurance. So we're going to ask Janet to squeeze and hold for as many counts as she can. So let's say she could squeeze for a count of 4. It's 1, 2, 3, 4, and relax. So that's 1. And after a couple of minutes, after a couple of seconds, or however long the patient needs or Janet needs, and it's squeeze again. So, and again, so it's 1, 2, 3, 4, and relax. And then again, 1, 2, 3, 4. And if she can't make 4, she can do 3 contractions. Other people may do 10 at that same, quality contraction that we did at the beginning. So we've looked at the repetitions, we've looked at the endurance. We can feel when the muscles start fatiguing, And we're beginning to get a personalized score for the pelvic floor. So then we're looking at the fast contractions. So we're going to ask Janet to squeeze, so just squeeze, and it's squeeze, relax, squeeze, relax, squeeze, relax. And again, we're going to look at the quality of the contraction and also, you know, how many tight, quick squeezes can we do? And then again, that's another part of the scoring. So we've looked at the performance of the pelvic floor muscle, the endurance, how long can we hold, how many times can we repeat that movement, and then obviously how many quick ones we can do. But all the time, you know, we will be looking and seeing, is the pelvic floor elevating? Can the pelvic floor relax? And then we'll also be looking at the abdominal muscles, because sometimes when we perform a pelvic floor, we tend to use our abdominal muscles instead of isolating our pelvic floor. So, you know, the timing of your pelvic floor, especially if you're going to cough and sneeze, is so important. So then we'll ask Janet, can you cough for me? And then we can see if you can cough and squeeze at the same time. And obviously we need those for our emergency moments. So as you can see, a perfect score is a pelvic floor muscle assessment isn't just can you squeeze. It's all about the quality of the contraction, the repetitions that you can perform, and you know, can you perform the different type? Are you able to isolate those muscle contractions, or are you using other more inappropriate muscles? Because what you don't want is using other muscles so you bear down instead of pull up. And a lot of women find it difficult to actually isolate those contractions. So there's loads of things we can do to help that. When we actually look at the shape of our vaginas, they're not actually round, they are more flat. And when you put Tampax in, you wouldn't actually go straight up, they come back at a slant. So this is the way we're looking at here for Janet. So basically, a vaginas are very similar to the shape of a mouth. It's smaller to open, but much wider around. So this is more of our shape, and that's one of the reasons that MyKORI is the shape that it is. And it also, by using it, gives us this flexibility of, you know, accommodating to the different shapes of women. So when you're using MyKORI, you may actually want to massage first of all this way, or you may actually want to be flat, depending on your individual anatomical shape. Every vagina is different. You never see two the same. So, you know, it's really important that you get to know yours, you get to know where the areas of tension are, to know what your normal looks like, your normal feels like. And massage is a great tool for that because it helps this mind-body connection. So anyway, you'd use loads of lubrication on MyKORI so it's all comfortable. And then basically what we're going to do is start off at the edge of the vagina and very gently massage around. Now 50% of women over the age of 50 will have a tendency to prolapse, and that can actually be caused from scar tissue from childbirth. So 90% of women were found in a research paper last year to have scar tissue even after a normal vaginal birth, and that's without even having any interventions. So basically you'd start off very gently around the edge of the vagina. You can massage over the perineum and the vulva as well, and that will help bring fresh blood to the area, which helps oxygenate the tissues and just gives it a nice plump consistency. So anyway, as you're massaging very mindfully into the vagina, now the word mindful is actually in the medical world, we call it interoception. So basically it's knowing how your body feels internally, so you can learn to focus mindfully on that tension. So as you're massaging very gently around, you're going to find those tight spots and then just either press and hold or just very gently massage over the area. and then you'll move around and you'll find another tight spot. I personally have a lot of scar tissue here on the left, and that tends to be much tighter, and it feels certainly different to the other side. So I may actually just get in there and very gently go over the area a few more times. And then I actually find that, you know, I was saying about the muscles going over the vagina, over the pelvis, that, you know, come from her back, from her hips. So internally I have there's a little bit of the obturator muscle that you can actually get to and massage. And I find that actually helps me with my hip pain. So obviously if there's anything that you're not sure about your vagina, then, you know, please do go and see somebody like myself, and they can help you out in more detail to find your perfect score and to give you more advice of massaging your scar tissue. So anyway, once you've inserted MyKORI and your muscles are nice and relaxed, then the next thing we will look at would be to activate the bullet. And you just hold it down for the count of 4 and then press to find the program that you'd like to work with. Now, once you've inserted MyKORI into the vagina, you're going to feel the vibrations, and the vibrations are quick vibrations, and slow pull up and holds. Now, the quick ones are the fast twitch that we've explained, and the pull up and holds are your endurance. But instead of going straight into your pelvic floor squeezes for strength, you need to learn to relax. So our pelvic floor needs to be flexible, it needs to be able to relax. So with the vibrations, you're just literally going to relax, release, let go. So you've massaged, you've relaxed, and then maybe you're ready to do the squeezes. So as MyKORI vibrates, you're then going to squeeze, and you're going to squeeze along with the vibrations. So you're going to squeeze and hold when you have the longer vibrations, and just squeeze and relax with the shorter ones. So that way we cover the whole range of making sure that the pelvic floor is relaxed and that it can release. We learn to release with the vibrations, and then we learn to contract with the vibrations. So, you know, it's just another I think it's a wonderful tool to give us ladies a bit more choice of helping our pelvic floors. It's such an important area, and we really do need to take care of it. And you can find, you know, you can always contact me via the website, and I am always happy to help and point you in the right direction. So anyway, if you are going to invest in one of these, have fun. You can use your imagination with it as well, because it does go, you know, internally. So anyway, have fun with it, enjoy it. Any questions, please do ask.